Etienne Landrois, Team Lead for Knowledge at the Partnership for Maternal, Newborn, and Child Health. Delighted to be here in Nairobi, Kenya for the International Maternal Newborn Health Conference. And today we are talking about a neglected tragedy in global health, and that is the challenge of stillbirths. We know that globally there are almost 2 million stillbirths every year, almost half occur here in Africa, and here on the continent there's one baby that is stillborn every 30 seconds. So huge tragedy. This is part of a new report that is released here at IMNHC called the State of Africa's Stillbirth Report. And I think it's important to also acknowledge that those are not isolated incidents. They're closely related to challenges around sexual and reproductive health and rights, but also low quality of care linked to poor maternal newborn health outcomes. So joining me today to discuss those challenges are Mary Kinney, Senior Lecturer at the University of Cape Town, and Vivian Gaiko, founder of EmpowerMama in Kenya, and also a strong parent advocate. Thank you so much for being here. Mary, we'll start with you. I'd like to hear your thoughts on some of the priorities and policy changes that are required to improve the prevention of stillbirth, but also move towards better outcomes for maternal newborn health.
Thanks, Etienne. And I think just to say thank you to PMNCH for featuring this report and this important topic. And you know, for me, there are 3 big policy shifts that need to happen. First is we need to really see greater investment in women, children, and adolescent health broadly, with intentional integration of stillbirth across policies, programs, and accountability mechanisms. We know that from this report that less than half of African countries have stillbirth rate targets in their plans, stillbirth reduction targets, and this is a really important inclusion in a policy for accountability. And oftentimes programs for maternal health don't include the stillbirth outcome or don't include specific interventions needed for stillbirth prevention or for care for parents after a stillbirth. The second big policy priority is going to be increasing and elevating the voice of affected persons, including parents and providers. And this is really going to require a push-pull, you know, a notion of nothing for us without us. And this will require governments and other stakeholders to be open to allowing the voices of affected people to the table, to the policy table at every process of the cycle, whether it's at the decision-making and making the policies, implementation, and accountability. But also there needs to be the demand for it. So really a groundswell mobilization demanding to be at the table to hold governments accountable. And the third policy shift to me is that impact. We need to count stillbirths to ensure that we learn and we are using that data for accountability. Every maternity register in Africa that I've ever seen includes stillbirth outcome, and yet very few countries report to the UN Interagency Estimation Group for Child Mortality that produces stillbirth outcomes every 2 years. And so that's a huge gap. And very few countries, we've also learned from the survey that we did for this report, actually create national reports that aggregate all the data for stillbirth and newborn deaths for decision making. So without actually having the data, we can't really make good decisions in policy.
Thank you so much, Mary, and thanks for highlighting the role of parents, advocates, of family-centered care. And that's a very nice leeway into a question that I have for you, Vivian. Vivian, you are leading an organization called EmpowerMama. It's here in Kenya. It's an organization that supports families that have experienced pregnancy or baby loss. So huge work, congratulations. A question for you around bereavement care. What are some of the changes that are really required to move towards family-centered care and high-quality bereavement care?
Thank you very much for your question and for having me in this panel today. One of the things and changes that are really, really important in bereavement care for parents is just having that inclusivity and allowing the parents' voice to be heard. So number one is listening to parents and involving them as partners in their own healthcare. They're the ones carrying the baby, They're the ones who know when changes happen. So listening to parents is key, is number one. And having the opportunity to also hear from testimonials from across Africa during the putting together of this particular report, and from the work that I've done since 2016 supporting parents who've gone through a loss, and to be specific, for those who have gone through a stillbirth, most of them say, I wish I was hard. So that's a major key thing, and compassionate care should really be the standard of care that we need in our health facilities.
Thank you so much, Vivian. Thanks for reminding us that behind the numbers there are family stories, lived experiences, and we need to put them to the front. So thank you so much. One last question for both of you, focusing now on the acceleration agenda, so moving faster at the 2030 horizon. Mary and Vivian, what is one priority where we need to do better in terms of accelerating the progress on the prevention of stillbirth, but also maternal mental health? We'll start with you, Mary.
Thanks. I would say intentional integration and explicit integration. So there's not a vertical agenda for stillbirth. This needs to be embedded within the broader health and human rights agendas and for women, children, and adolescent health. And we've seen shifts happen in the past decade to see the community saying, and stillbirths, when they're referring to maternal mortality and newborn mortality, which is great. But it needs to actually trickle to countries that they're also intentionally including stillbirths in their burden for maternal and newborn deaths, and also in their policies, and their accountability mechanisms, and in their programs. Often, whether it's a research study or a program, they're not including stillbirth as an outcome indicator for maternal health. But we know that stillbirths is a very sensitive marker of your health system's resilience and strength. So we really just need to see that explicit integration of stillbirths across the board.
Yeah, thank you so much. Critical health systems perspective.
Yeah, in addition to the integration of stillbirths, just counting the stillbirths and making sure that we learn from the previous losses, from the collection of the testimonials and just listening to parents. Some were very open to share their stories, saying that if my story would help save another life. So we're actually using this information to help prevent future stillbirths, with the projection being 5 million stillbirths if we don't do nothing by 2030. We do not want that to happen. Already there are parents who have gone through this. There are issues that we have seen that have led to these stillbirths. If we use that information, then we're able to prevent the stillbirths.
Thank you very much, Vivian. So thank you, and this is a strong call for action to do better on the prevention of stillbirth and improvement in maternal newborn health. Thank you for listening.